Good morning, Dr. Meera. I was hoping you could help me understand liver failure in detail. I know it's a serious condition, but I'd like to go deeper into its causes, symptoms, and treatment. Of course, Arif. Liver failure is indeed a life-threatening condition. Simply put, it occurs when the liver loses its ability to function properly. The liver is one of the most important organs in our body. It helps in digestion, detoxifying harmful substances, storing energy, and making proteins needed for blood clotting. Right. I remember that from physiology. So when the liver fails, what exactly happens inside the body? When the liver stops working, toxins that are normally filtered out begin to accumulate in the bloodstream. This affects many organs, including the brain, leading to serious complications. Without a functioning liver, the body simply cannot maintain its normal internal balance. That sounds quite serious. Are there different types of liver failure? Yes, we classify liver failure into two main types, acute and chronic. Acute liver failure develops suddenly, often within a few days or weeks, while chronic liver failure takes place gradually over months or years due to continuous liver damage. Could you explain more about the difference between acute and chronic liver failure?
Certainly. Acute liver failure, or ALF, occurs rapidly, sometimes in people who had no previous liver disease. For example, someone might take an accidental overdose of paracetamol, and within a few days, their liver starts shutting down. It's a medical emergency because it progresses quickly and can lead to brain swelling, bleeding, or even death if not treated urgently.
So, it's like the liver suddenly collapses?
Exactly. On the other hand, chronic liver failure happens slowly. It's usually caused by long-term damage from things like chronic hepatitis infection, alcohol abuse, or fatty liver disease. Over time, healthy liver tissue is replaced by scar tissue, a process we call cirrhosis. Once the liver becomes cirrhotic, its function steadily declines.
So, chronic failure gives more time for treatment and monitoring, but acute failure demands immediate care.
Precisely. Acute cases are unpredictable and dangerous, while chronic cases allow us to manage the patient and slow the progression if detected early.
What are the main causes of acute and chronic liver failure? Let's start with acute liver failure. The most common cause worldwide is viral hepatitis, especially hepatitis A, B, and E. Then there's drug-induced liver injury, with acetaminophen overdose being the leading cause in many countries. Other causes include exposure to toxins like poisonous mushrooms, autoimmune hepatitis, or adverse reactions to certain medications. Interesting. So even something common like paracetamol can cause it. Yes, if taken in large doses. The safe limit for adults is about 4 grams per day, but exceeding that can overwhelm the liver's detoxification capacity. Many people underestimate this and take multiple cold or pain medications that contain acetaminophen without realizing it. That's alarming. What about chronic liver failure? Chronic liver failure is usually caused by long-term conditions. Chronic hepatitis B and C infections are major culprits. Alcoholic liver disease is another leading cause, especially among people who drink heavily for years. Non-alcoholic fatty liver disease, or NAFLD, is becoming increasingly common due to obesity and diabetes. Then there are genetic disorders like Wilson's disease, where copper accumulates in the liver, and hemochromatosis, which causes excess iron buildup. Long-term exposure to certain industrial toxins can also contribute. So, lifestyle and genetics both play major roles? Absolutely. Chronic liver failure often develops silently over many years due to unhealthy habits or undiagnosed infections. Once liver failure is suspected, how is it confirmed?
The first step is blood tests. We look for elevated liver enzymes like ALT and GST, which indicate liver cell damage. We also measure bilirubin levels, albumin, and prothrombin time to assess how well the liver is functioning. If the blood takes longer to clot, it's a sign of severe impairment.
Do imaging tests help too?
Yes, ultrasound is a quick, non-invasive way to check for structural changes, fluid buildup, or tumors. In some cases, we use CT scans or MRI for more detailed imaging. For chronic conditions, we might do a liver biopsy to evaluate the extent of scarring. And if we suspect hepatic encephalopathy, neurological tests can assess brain function.
So, diagnosis involves both lab work and imaging.
Correct. And in acute cases, we also run toxicology screens and viral panels to identify the exact cause as soon as possible.
I assume treatment depends on whether it's acute or chronic, right?
Exactly. For acute liver failure, the patient must be admitted to an intensive care unit immediately. The priority is to treat the underlying cause. For example, giving an acetylcysteine as an antidote for paracetamol overdose or antiviral medication for hepatitis. Supportive care includes maintaining fluid balance, preventing infections, and managing complications like bleeding or brain swelling. If the liver doesn't recover, liver transplantation becomes necessary.
And for chronic cases?
For chronic liver failure, treatment focuses on controlling the underlying disease and preventing further damage. For instance, antiviral drugs for hepatitis B or C, complete abstinence from alcohol, and a balanced, low-fat diet for those with fatty liver. We also manage complications, diuretics to reduce swelling, lactulose to treat encephalopathy, and sometimes beta blockers to prevent variceal bleeding. If the liver reaches end-stage failure, transplantation is again the definitive treatment.
So, liver transplant is the last resort.
Yes, but it's also life-saving. With modern techniques, the success rate is quite high, provided the patient is otherwise fit and follows medical advice.
This all sounds quite serious. Is there a way to prevent liver failure?
Absolutely. Prevention is key. The most effective steps include getting vaccinated against hepatitis A and B, avoiding alcohol abuse, and using medications responsibly. Many people don't realize how easily the liver can be damaged by mixing prescription and over-the-counter drugs. It's also important to avoid exposure to toxins, whether industrial chemicals or wild mushrooms.
What about diet and lifestyle?
Maintaining a healthy weight, eating a balanced diet, and controlling diabetes are crucial, especially to prevent fatty liver disease. People with known liver conditions should have regular checkups and blood tests to monitor their liver function. Early detection can make all the difference.
That makes sense. Prevention seems much easier than dealing with the complications later.
Exactly, Adav. Once liver failure sets in, recovery is difficult. But with awareness, vaccination, and healthy living, we can prevent many cases.
What's the prognosis like for liver failure patients?
It depends on the cause and how early treatment begins. In acute cases, if the cause is treated quickly, some patients recover completely. But if there's extensive liver cell death, transplant is the only hope. Chronic liver failure progresses slowly, but with proper management and lifestyle changes, patients can live many years with good quality of life.
That's reassuring. So, early detection really changes the outcome.
Absolutely. Unfortunately, many people ignore early symptoms like fatigue or mild jaundice until it's too late. Public education is vital. People must understand that the liver can regenerate, but only up to a point.
That's fascinating, doctor. I didn't realize the liver had such regenerative power.
Yes, it's one of the few organs that can repair itself, but repeated injury from alcohol, viruses, or toxins overwhelms its capacity. Once scar tissue forms, it's irreversible.
So the key takeaway is protect the liver before it fails.
Exactly. Prevention through vaccination, healthy diet, and avoiding harmful substances is the best strategy. And for those already diagnosed with liver disease, regular follow-ups and medical adherence can prevent progression to failure.
Thank you, Dr. Mira. This discussion really helped me connect all the concepts, from causes to treatment.
I'm glad to hear that, Anav. Always remember, the liver is a silent worker. It doesn't complain until it's severely damaged. So we must educate our patients to care for it before symptoms appear.
That's a powerful message. I'll definitely remember it. Thank you for your time, doctor.